Well, welcome everybody. I just wanted to note we are going to record this. We had some people message us who aren't able to join us live. So we're going to be sending it to them via a recording. So just wanted to make everyone aware who's joining us live. We are going to give folks another minute or so. We know it is quite early and many people have early meetings. So we're going to start just a little bit after 10. But thanks for joining. If you feel comfortable, you're welcome to put in the chat who you are, where you're joining us from, what your title is, or what organization or affiliation you have.
And we're also hoping at some point for some good participation. So if you feel comfortable on screen, that's fine. If you don't, that's fine also, but we're hoping for good Q&A.
You can also chat your question, right? So.
Yep. Biography and memoir, that's cool. Hey, Zoe. Cricky, when you feel like we should start, just let me know.
Great. It seems like folks are able to type who they are, where they're from, where they're joining us from, either organizationally or physically. But we welcome you to do that as you're entering. We have folks who are still joining, but I think we can kick us off pretty soon. Just a reminder, at any time, you can put your questions in the chat. Our presenters have a really great program today. You're welcome to be on camera, or if you're not comfortable, you're welcome to take yourself off. We will be sharing some things afterwards, but if there's any other questions that you have, we'll share some contact information if you have any follow-up questions after today. But with that, I'll pass it over to my colleague, Cathy.
Thanks, Cricky. Hi, my name is Cathy Creighton. I direct the Buffalo office for Cornell University's ILR School. I'm also a proud graduate of ILR and Boston University Law School. And before joining Cornell, I worked for 30 years as a labor attorney representing labor unions. I'm going to moderate today's program. So I'm really excited about this program. Today, we're going to talk about what essentially amounts to 3 related topics. First, we're going to hear about how persons who are impacted by the United States criminal justice system face obstacles to working after they are released from the system. Then we're going to talk about how the COVID-19 pandemic impacted working people's lives at their jobs and how that also impacted the rest of their lives in the United States and in Poland. And finally, we're going to talk about ways that workers have found to alleviate or stabilize the precariousness or the suffering of their working lives. So I must admit that these topics may seem oddly disjointed, but what they all share in common is the precariousness of work and how that precariousness bleeds into life and vice versa, how life leads into work. And also what support systems can alleviate such precariousness. And what makes this program so interesting is the research that has been done through biographical interviews of people, as will be explained by our panel. And those biographical interviews took place in Buffalo, New York, and Rochester, New York. This panel is not necessarily for an audience of academics. This panel did present to an audience of academics in Manchester, England, but this is designed to be a broader audience, including people who are part of the research study. The person who really brought all of us together today is Ian Greer. Ian is a research professor at Cornell University's ILR School, and he directs the ILR Ithaca Co-Lab. Ian's academic research looks at the intersection of industrial relations and the welfare states in Europe and North America, including the causes of unemployment and precarity at work. Ian met Adam Mrozowicki around 2010 when they were both hanging around the European research scene. I like that kind of hanging around the European research scene, labor research scene. Ian was aware of Adam's work as a distinguished Polish sociologist and Adam's work doing biographical interviews. And this is what Ian has to say about Adam. Adam is an eminent Polish sociologist. If you want an international partner on your project, then Adam is your man. But Adam is in demand and he turns down many people and many projects because he is so famous he can afford to be choosy. Adam Mrozowicki is a professor at the University of Wrocław. Maybe you can help me say that correctly, Adam.
Wrocław, that's perfect, Cathy,
Yeah.
thank you.
I'm saying it so poorly. He's the head of the Department of Sociology of Work and Economic Sociology at the Institute of Sociology at that university. Adam's recent research includes precarity and essential workers' coping strategies with interlinked crises. He's been published in so many journals and he's written many articles and books, etc. I won't go into all of that. Adam was awarded a Fulbright visiting scholar at Cornell University, and he came to the ILR School in March through August of 2024. Adam came to Cornell with Jacek Burski. Hello, Jacek. Jacek is a sociologist and assistant professor at the Institute of Sociology of the University of Wrocław. Sorry, I'm saying it wrong. Jacek came to Cornell when he received an Excellent Initiative Research University grant from his university, and Jacek's work focuses on the sociology of work, biographical sociology, precarity, and social change. And so it was that Ian was delighted to learn that Adam and Jacek were coming to Ithaca, New York. And when they got to Ithaca, they stated that they were looking to interview healthcare workers, and Ian kindly introduced them to me, and they came to Buffalo to do biographical interviews of healthcare workers at hospitals, nursing homes, and home healthcare aides. And I was so fortunate. They stayed with me at my home, and each night they would regale me with stories of the struggles of American workers. And they talked to the workers that they had talked to during the day. And I was so interested in this methodology that they used for their work, their research work. I didn't know at the time that these two fellows were famous, so I probably didn't give them the respect that they deserved. But I did invite over many friends and Polish descent so they could feel at home. And I think we had a really fun time. I've now read the work that they have accomplished from their research. And I want to say that Adam and Jacek, it was really an honor to have had the opportunity to work with such eminent international scholars as you two both, and have you here with us in New York State and in Buffalo and at Cornell. And I really want to thank you both. And I also want to thank CWA and 1199 members for supporting your research and your time and the passion of your work. At the same time that this was going on, over in Rochester down the thruway, Ian Greer was working with Michelle Chen. Michelle is a postdoctoral fellow in history at the Cornell ILR School, and she teaches labor and working class history, and she studies the intersection of work, migration, and social movements. And she's also been a journalist where she's covered labor issues. They worked, Ian and Michelle worked with the Law New York and Judicial Process Commission, who have people here today. And they also did biographical interviews of persons impacted from the criminal justice system. So what we're going to do is we're going to hear first from Ian and Michelle, and then we're going to have some Q&As, and then we're going to hear from Adam and Jacek, and we're also going to have Q&As. But anytime anybody has a question, please do just raise your hand and we'll call upon you. And so I'm sorry that was so long. I'll stop talking now. So Ian and Michelle.
Can you all see this? Okay, great. All right. Still trying to navigate the presenter view thing. Okay, so thank you, Cathy, for the great introductions, and thank you all for being here this morning or afternoon in Poland. And it's really exciting to present this research and also to see some of the folks that we worked with in the audience. So that's really great. We started our research looking at this question about how people's work lives are changed by a criminal record. We started with this premise that having a criminal record can seriously disrupt your prospects of getting a decent job, of advancing your career, of obtaining any stable employment at all. And one of the main reasons is because employers regularly conduct criminal background checks on job candidates. And fundamentally, there are both legal and cultural barriers to economic opportunity that come with having a conviction on your record. Should be noted that it is generally illegal to deny a job to someone specifically based on a criminal record unless it directly relates to the duties of the job, but that's not typically how it works in practice in many cases. There are some sectors that legally bar people with certain convictions due to public safety concerns. So that's another barrier that is sort of baked into the law. And there's also more generally the stigma and the overall discrimination that comes with having a criminal record. And there is research showing that a past criminal conviction can significantly reduce the likelihood of a job offer. It can also reduce the likelihood of simply getting called back for an interview if that information becomes known to the employer. And why is this important? Because about an estimated 85 million to 104 million people, maybe 1 in 3 US adults has a criminal record, right? So this is a huge swath of the population. And we know that there are disproportionate effects on Black and Latinx people in terms of how they fare in the criminal justice system at all levels and the economic collateral consequences of that. So we looked at state level laws that may make it easier to seal your records, to limit the use of criminal background checks, and thereby to combat employer bias, because these are mechanisms that are available to people with criminal convictions to sort of, clear up their record, to limit the information about their record, or limit access to their rap sheet from prospective employers. And we know that only a tiny percentage of people eligible for relief generally access it. And we know that accessing these mechanisms for relief can be crucial to getting a better job. And we also know that getting a better job can reduce recidivism, can stabilize the communities that are disproportionately impacted by the criminal legal system. And so we wanted to look at that gap and what's happening in people's lived experiences that is creating these barriers. So we know that in terms of the relief that is available to people, people with criminal records can apply to have their records sealed. They can obtain a certificate of relief or a certificate of good conduct, which is a mechanism that the Department of Corrections makes available to people. There's an application process, and you can obtain a certificate that can sort of, vouch for your worthiness of employment and overcome employment or licensing bans. And typically in a place like New York State, we know that in most places, like maybe less than 5% of people who are potentially eligible actually seek a certificate of relief, right? So why is that? We know that there's low knowledge about this relief among both the impacted individuals and among prospective employers. We know that there are inconsistencies and arbitrariness in terms of how these policies are implemented among probation officers, judges, Department of Corrections. And again, there's fundamentally just, issues with discrimination and stigma that persist regardless of these specific mechanisms. We also spoke with JPC and Law New York, 2 nonprofits that are working in the Rochester area to help people cope with the reentry process, access this kind of relief. And they also play a critical role in providing legal advocacy and redress when it comes to, getting relief from the system when it doesn't work as it should. And we also know that coming down the pipe, there is a new policy called Clean Slate, which should, at least in theory, automatically seal most records. And that is being implemented, it appears, incrementally. We're not exactly sure how consistently that's being implemented. And so the basic question you wanted to get at is, with all these mechanisms of relief, are they enough? Right? We know that there is precarity at work that many of these people experience. That is the risk of job loss, the risk of injury on the job, just poor working conditions generally. And this can be mitigated by different institutions. So this can be mitigated, for example, by those forms of relief that we talked about. It can also be mitigated by institutions like unions. And we also know that there are factors outside of the workplace that can impact people's ability to both obtain employment and also obtain the necessary relief that they need in order to move forward with their lives. So that involves risk of violence, eviction, unstable housing, deportation, poor health, etc. This can be mitigated by social support networks, by your family, your friends, church, public benefits, etc. So the research questions that we approached this question of these services is, what difference does this kind of relief make in workers' lives and how they talk about their lives, how they conceive of their sort of life trajectory? Does the certificate of relief process or the record sealing process actually lead to better employment outcomes? And how might other social problems compound the barriers that come with having a criminal record, right? And we spoke with Legal Assistance of Western New York, and we also spoke with the Judicial Process Commission, nonprofits that sort of work with individuals at different points as they're trying to either, overcome the effects of a criminal record or re-enter after a period of incarceration. Our sample included 30 service users of these two organizations. They were helped with things like record sealing and getting certificates. They're also aided in navigating the background check process with the Department of Health, which is where many of them needed to apply to in order to get a license to work in healthcare. Right? They also participated in actual legal action against employers, administrative hearings, and other sort of litigatory services that can help people overcome the impact of a criminal record. The common charges in our sample included petty larceny, drugs, drunk driving, obtaining weapons, right? Less common were murder, manslaughter, disorderly conduct, wire fraud, sex offense, forgery. So there's a whole range of different offenses that people have in their records, and the ages also range quite widely from people in their 20s all the way up to 65. We're dealing with a population that is mostly Black and mostly women. Our sample was 16% Black women, 16 Black women, 9 Black men, 3 white women, 2 white men. And most of these folks were involved in some way in the healthcare industry. They were either working in healthcare or they were training to obtain a career in healthcare, but they were also involved in other low-wage service work. They're involved in manufacturing. Some of them worked in reentry services, right? They're actually providing the services that they themselves benefited from, and others were simply doing unpaid care work for family members. And I just wanted to focus on one case study before we sort of get into the meat of our findings. We spoke with Leah, not a real name, a woman in her mid-20s. She experienced a lot of the issues that we were looking at in our sample, a lot of the sort of cascading destabilizing factors that both precede and follow a criminal conviction. So she dropped out of school when she was 17 after she had been shot while pregnant. She had been pursuing her GED, but she stopped that due to all the difficulties, the hardships related to health, parenting, etc. She later caught several charges. First, she was manipulated by a friend into a scheme involving stealing from an ATM. So she got 5 years probation for that after pleading guilty. Then she got a DWI charge, a driving while intoxicated charge. This led to some bureaucratic misunderstandings that led to her missing court dates, more probation, more court-ordered supervision. She later caught a theft charge while she was working as a rideshare driver, got more probation throughout this time. She had several bouts in jail. And the services that she got initially should have been enough in theory. Like she got certificates of relief with the help of JPC, but when she applied for a job as a medical technician, she was told by an employer that her criminal record still barred her from working in that industry. Law New York got involved, helped advocate for her legally, filed a lawsuit. Now she's in a more stable place. By the time she talked to us, she was finishing her training to be a nursing assistant, but she wasn't yet employed. She hoped to get out of low-wage service jobs, but she mentioned that this was the only kind of job that she could get with the charges on her record. So her life was really at a cusp when we spoke to her. So barriers to work remain high. Her story really shows that even while formal relief is important and in some cases crucial, it still might fail to mitigate the sort of multi-layered barriers that people face when they have a criminal record, even years after catching charges. Even after the relief is granted, the prospective positive effects of that relief are not guaranteed. And certificate of relief was one step in Leia's journey toward a nursing career, but her future prospects may depend on the support she gets from her community, from institutions like JPC, or perhaps from a union or a labor advocate. And that is sort of our segue into Adam and Jacek's study, but I'm going to hand it over to my colleague Ian, who will get to the meat of our argument. Thanks.
Hey, Michelle, before Ian starts, I have a question. How, if she had that certificate of relief, how was it that her employer knew that she had a criminal record?
Yeah, so that's the issue. So from what we gleaned from our interview, the certificate of relief doesn't actually seal your record, right? It's a certificate of relief that you obtain that the employer then sees, and they're supposed to weigh that as they are considering hiring a person with a criminal record. So, so there are different types of relief that people can get depending on what their actual conviction is, right? And so some people with more serious charges end up going for a certificate of relief. So it really depends. There are all sorts of sort of cultural factors that come into how an employer will respond to that, right? It really kind of depends on whether the employer can provide, can sort of give people that sort of, they call it a second chance, right? This is called sort of second chance relief. And for whatever reason, she was still told that she was barred, and then that led to further sort of a need for further legal advocacy. So all this to say, whatever the details of Leia's particular case, there are a lot of barriers that remain even when you get this piece of paper saying, oh, right, like you've proven yourself.
I didn't realize that. I thought it hid your criminal record. I didn't realize.
No, I mean, so yeah,
on.
and it's a whole sort of mishmash of the different types of relief that people can, and maybe we can get into this in the Q&A. It's confusing, but basically, unless you have a law degree, it is really difficult to figure out what kinds of relief are available to you, what you qualify for, and how employers should respond to it. So that's the other issue.
I have a legal degree and I don't understand. All right, thank you.
Well, maybe Jason and the JPC folks can fill us in the end. But it's so amazing to see you all, and thanks for joining us. So I guess when I started doing this and I learned the basic idea of it, I sort of expected that we would meet people who got assistance, some sort of relief, like sealing or certificates or help navigating the background checks of Department of Health. The idea is we would see a change. So the default is someone with a criminal record faces rampant employer discrimination. They're stuck in bad jobs or they're unemployed. And then they're kind of trapped in a chaotic life, marked by poverty, recidivism, etc. So you provide relief. This means less employer discrimination. This should mean better jobs, and it should mean a better life. You escape poverty, stay out of trouble. That's the basic idea. What we found out was it was more complicated and varied than that. So there are people we met who are ineligible for the service because of the nature of their crimes. For example, if you're a sex offender, you're not eligible for relief. Setting that aside, there are some people where the service was successful in removing and sealing a record or providing a certificate, but the person had not yet progressed in life. There were other barriers in their lives, such as bad jobs, or other things going on in their lives. So an example of this is someone we call Jessica, who's in her mid-20s, Black woman. She really wanted to move into nursing. She got a job and then she witnessed patient abuse, which she found appalling, and she just quit and she switched to self-employment. Um, so her path was blocked by a bad job. Um, we also see some cases of success, though. So this is kind of corresponds to what we expect, you know, that a barrier to progression is removed. Someone moves into a better job than they had before. We can see in their biography that their life is less precarious than it was before. We have 3 or 4 cases of this. One is Haley. She was denied nursing jobs due to her record. Law New York took up the case with Department of Health, which was blocking her getting hired. And now she's in school and working in nursing. Um, a fourth group, which I really did not expect to see, but there were 5 people like this who their lives were already pretty stable. They were already working. The service might be useful in the future if they change jobs, but in many cases, they're not motivated by employment to get the service. So, for example, Sally, who is older, she used the service, and then she found a job where a criminal record is not a problem. Um, so this is about half of our cases where we can say something about the effect. For about 16 of them, these are people who had walked in the door of JPC in Rochester. They're new clients, and we just don't know what the effect is. We have to talk with them in the future to find out. And many of the people who had frustrated paths, they might progress in the future. And so we just have to see what the result will be. Common features of these stories were childhood trauma, often abuse, um, and then kind of a chaotic everyday life as an adult, precarity at work, bad jobs or no jobs, precariousness in life, often some very horrible relationships with other people, interacting to kind of trap them in a place that they want to get out of, so they can get help from reentry services or church, family, and friends. At the same time, they can still face employer discrimination and other structural forces of oppression. They talk about daily experiences with racism, sexism, often having to do with their interactions with the criminal justice system. In these stories, we often hear about personal crises and turning points, which either lead to stabilization or they lead to a frustrating situation in which they revert back to their previous life. And in one case, we have 3 personal crises where they go back to their precarious life. So it's a real challenge for the people we met to really accomplish what they're trying to set out to do, to find the path towards a better life. Um, so yeah, we're still learning what the effects of the service are on workers' biographies. We've learned a lot about the problems. We've learned a lot about why these services are needed, what the providers of these services and their clients are up against. For about half, it's too early to say what the effect is. We have some success stories, but not as many as we were expecting. And other people who are ineligible, who are frustrated because of their precarious lives, or they already have stable lives and they get the service for some other reason. So we're going to talk to respondents again in 2026 to figure out what is going on with them, who has progressed, why. role of other interventions and services, maybe involvement in unions like Adam and Jacek's respondents, and also the effects of the clean slate reforms in New York State. So that's it for me. Unless there
Does
are
anyone have any-
questions, I can
does
answer
anyone have any
them.
questions? I mean, I have a couple of questions, Ian,
All right.
if I could go ahead. Okay, so was it how did you do, like, how do you do these biographical interviews?
I had never done proper biographical interviews before. I learned about it from Adam and Jacek, and I had read about them. But they always start off with the question, tell me your life story from your first memories until now. And we chose those because the services are supposed to be interventions in people's life stories. They're supposed to help people who want to turn their lives around succeed in doing so. So I thought the biographical method was really cool, and it's quite different from how these services are normally evaluated, which is quantitatively through surveys. We started off working with Jason at Law New York, and because the program is quite small, we couldn't do a big survey and statistical analyses, so it became really important to look at the details of people's lives. So we'd ask them, tell me your life story, and then we'd follow up with questions about their criminal justice involvement, their work history, and other things that are that would help us understand what the effect of the service is on people's lives.
That's very interesting. I'm gonna butcher your name, Marchietta?
Perfect. Thank you very much. Yes, perfect pronunciation. Thank you very much, Ian and Michelle. Listen, since you've got now this rich data, which is much broader than only the focus on labor market and if people work or not, if they're precarious or not, and how stable their lives are. And since you know that many of them, or majority of them, have been traumatized already as children and young people, so do you have any intention of focusing on mental health and mental health support as well? Like, my question is, are you planning to go beyond the focus on work and employment?
So we always ask them about the kinds of supports they receive, and they often talk about mental health and other kinds of health. So their their lives affect their health in many ways. There's So we do ask them about that. And I mean, really, it's very different. So I'm a labor researcher. In the
Yeah.
past, I've always asked people about their jobs and their unions and things like that. And these respondents really center their lives outside of work in their stories, in part because we have prompted them to say, well, we're interested in how where this is about criminal justice involvement and employment. So the criminal justice piece comes first. But yeah, health is important, and you often in the course of the interviews, you can really get a lot of can really see how people are struggling actually in terms of their mental health. And one really has to be cognizant of that actually. So this is also something to navigate as a researcher. People who can really be set off quite easily by asking stupid questions, which as researchers we often do.
I would also add that several of the individuals we spoke with were currently seeking some kind of mental health treatment or therapy, or they had in the past. And so that would be part of their biography. But I think people had varying levels of like lucidity and kind of consciousness when thinking about their mental health. And since we are centering sort of the personal sort of biographical sort of testimony of these people, you know, as a researcher, you kind of have to be aware that people may be at different stages and kind of like their journey in terms of dealing with that. So, and, you know, I think that's one of the reasons we're doing follow-up interviews down the line. But, you know, most of these people are to some degree sort of keyed into some kind of social service. And so the hope is that if they need that help and actively are at a place in their life where they want to sort of seek it proactively, then it will be there for them. But that's also what we're trying to figure out in terms of how these people interact with the institutions that are around them. And it's also worth noting that many of the peoples who had childhood trauma, that was also related to mental health issues in the family, or substance use disorders and things of that nature.
Yes.
And I think
Thank you.
what is interesting also is that if we compare those stories with stories we collected in Poland, not necessarily with care workers, but in general, I think there is much less presence of this therapeutic discourse, which we observe in the Polish cases. Or it might be also my cultural insensitivity, difficulty to detect this discourse in the stories which we collected. But we know that people going through various kinds of treatment therapies, they use the language of the treatment quite often in telling the story. And even though we did have in our sample such stories with people mentioning that they went through various kinds of treatments, it was much less visible that they used the language of the treatment, and that's was kind of intriguing.
I have a question for Jason. So this, I mean, this is a small sample, Jason, but it's like 4 out of 30 success stories thus far. I mean, that's, you could look at that 2 ways, like four lives is better than no lives. And, or you could say that's kind of dismal statistically. I mean, I don't know how you're looking at it.
I was looking in terms of there's the 4 and the 5, and also that's like a larger piece in terms of, so some of the folks that were in the study may not have received any of our services that were going through the JPC. So we're a smaller Venn circle of the actual population. But what I saw was that there were 5 folks who were stable, who got the stuff, which is what we run into all the time. Also, I think there is something about when we talk to people about criminal records, there's a good portion of people that are like, yeah, I have a criminal record, but it never was a barrier to me because I'm the type of person that if there's a barrier, I overcome it. So there's a lot of people who like the way they will talk about it will not talk about it in a way that you would think. And I do that all the time. And I'm like, you have a felony. It was not a problem. No. I'm the type of person. And that very probably is true. They are those type of people, but it certainly still was a barrier. Still, they lost jobs. But that's not how they're going to focus on it. So I think part of it is some of the folks, how they're going to present it. But in terms of, I mean, is it what I thought where we were going to get out of it? Because my thinking when I came to Ian about this was to me, from my point of view, it's a lot clearer because we're seeing people come in who don't have a job because of their criminal record, and then we're reversing that problem. So we don't really see the tail end of it. All I know is it's a person that came in with a problem that I could legally resolve, and we did resolve it. And so they go in our books as a win. We just always assumed their lives get better. But when I kind of start thinking about it, and certainly my friends at the JPC say, it's not that simple. Like a lot of these jobs that were getting resolved, we're not going to take them out of poverty. Like the job that they got, the CNA, is still a very hard job that is paid at like an unlivable wage. And so I guess from our point of view, maybe it makes sense because you're a professional working on a problem and resolving that problem. You're like, yay, look at me, we succeeded, and we're not seeing the rest of the story. And that the reality is our clients are still living in a world where everybody assumes they have a criminal record anyways, because they come from certain communities, and that community is being stigmatized overall. But to me, it's always, because I'm a curious person, always very, very interesting, the outcomes, but it also shows you how entrenched all these problems are. So I guess that would be my response.
Can't stop fighting. Does anyone else have a question for Ian or Michelle? Well, thank you, Ian and Michelle. And I'm curious how I'm very curious how the clean slate legislation will impact your research in 2026. And thanks. And we didn't talk about how the research impacted you, but we could talk about that another time. I'm sure it's sort of tough to hear all these stories of childhood trauma all the way through. Okay, let's go next to Adam. Take it away, Adam.
Yeah. Yeah. It is all right now. Can you hear? Can you see it?
Yes. Yes.
Yeah. Great. Thank you very much, Cathy, for very kind introduction, which was completely exaggerated, but we have a lot of of conversations around and jokes around this kind of presentation of ourselves when we were with Jacek in Buffalo. So it's really our great pleasure to be here and to talk about our research and our preliminary results. This is very intense research, time-consuming research, so we are still in this preliminary phase, but still very happy to share what we have so far. And we are particularly happy that this is also an opportunity to speak back to some of people whom we interviewed or with whom we collaborated, because that's also a part of the approach which we are using and the reason why we are using this approach of collecting life stories. So we came with Jacek in spring last year to Ithaca, and from there we made it to Buffalo with the great help of Cathy, Ian, and three union locals: SEIU 1199, CWA 1168, and CWA 1133. And the reason why we came to Buffalo was the study which we designed as a follow-up study to the project which we had earlier in Poland. That was the project about the ways of coping, dealing with the pandemic crisis by essential workers, among other things, healthcare workers. So being in Buffalo, we managed to collect 25 interviews, biographical interviews with workers in hospitals, nursing homes, and home care. So this was quite a diverse sample in terms of race, in terms of unionization. It was very feminized as well. And the main question which we asked ourselves during this research was the question which is stated here. So how did workers deal with the COVID-19 pandemic and a series of interrelated social crises from the perspective of their entire life experiences? So just like Ian and Michelle, we collected entire life stories. We didn't focus in particular on pandemic or crisis. We wanted to see those crises from the perspective of entire life experiences, and our participants were free to choose which aspects of the stories were important for them to share with us. And quite soon we realized that what workers were facing was not just the shock of the COVID-19 pandemic, but a longer and more chronic crisis, and often less spectacular series of crises of care and a larger socio-political crisis of American society, which we called, following the inspirations from feminist scholars, a crisis of care and social reproduction. So basically social reproduction theory says that there is a systemic tension between, on the one hand, the everyday reproduction of life, and on the other hand, the principle of capital accumulation. So basically a contradiction, systemic contradiction within capitalism, between reproduction and care. And from this perspective, the COVID-19 pandemic was just a moment of this bigger contradiction. And it also revealed, as Valeria, one of the unionists whom we interviewed, who is quoted here on the slide, said how broken the healthcare system in United States of America is. And we can also say how broken in general in many countries in the world the healthcare system is. As some researchers like Ariel Afgar said, this broken healthcare system, they use the same expression, by the way, is manifested in the fact that, quote, insufficient resources preclude the delivery of the quality patient care. On the other hand, a lack of the public health investment and preparedness erode population health. And an important aspect which we saw in the stories which we collected of this broken healthcare system was also the chronic problems which workers faced before the pandemic, which included chronic staffing problems leading to work intensification and excessive working hours, and low and inadequate wages, in particular in the case of job titles other than physicians and some of the registered nurses. So then another thing which we observed quite clearly, looking at listening to those stories which we collected, was the observation that despite all this chronic crisis, what workers shared was the biographically shaped ethos of care, which helped them to go through those crises which they were facing. And this ethos was manifested in a common statement in biographies which we collected, that participants loved taking care of people. And some of them, like Anne, the LPN, so nurse in nursing home, said, also mentioned that it's a kind of toxic relationship. So they love taking care of people, but they hate and they're extremely tired of those chronic problems which they were facing. So, for instance, short staffing, which she mentions. And we realize also that the ways in which the care ethos is acquired relate differently to various pathways into care occupations that were visible in our data. And we can classify those pathways to care occupations by referring to those three broad types. The first type is this next shift pattern. So I refer here to famous book by Gabriel Vinant, Next Shift, which usually involved intergenerational occupational mobility from working class jobs in manufacturing and into the middle class care jobs. The family context here was relatively stable, supportive. There was also intergenerational transmission of care ethos, and parents who had some resources from those jobs previously in manufacturing invested in professional education of their kids. Then there is a second pattern, the pattern of escape from precariousness. The experience of precariousness in this case is kind of chronic. It's often experience of racialized poverty and subsequent low-paid jobs, including the jobs in the care sector, which are also low-paid in this case. But still, and this is a common experience in entire collection of interviews which we had, is that even those low-paid care jobs are better than the jobs people had before they entered into the care field. And then the last pattern is relatively rare but interesting pattern which we call status swing. So these are the people who started their career outside the care sector. Sometimes these were relatively well-paid jobs outside the care sector, but they were affected by interlinked crises and they had to lost those jobs, and then the care was a sort of last resort to which they could turn and to get some kind of stability through working in the care sector. And regardless of those different pathways to care work, as I said earlier, care was a relatively stable field until pandemic. Pandemic was commonly presented in interviews which we collected as an external shock, which was difficult to manage, which was marked by very high risks, of course, by fear, but also by the feeling that there is not enough support from the institutions, from the state, from the federal institutions, and that workers have to manage this pandemic largely by referring to their own biographical resources, to the networks of other people, to their professional knowledge. And what is important in this data which we collected is that this pandemic was quite often presented, usually presented as a part of other interlinked crises. So again, classifying those crises, we can say that workers refer to various social crises, including the crisis of communities, neighborhoods they lived in, often marked by the experience of everyday racism. Then political crisis, which was manifested in the feeling of being a subject to political polarization, which in case of healthcare workers was manifested in for instance, in tensions over vaccination, in a common feeling of distrust of medical knowledge, which was magnified by and fueled by political discourse in the US. Then the pandemic intersected also with economic crisis because it was followed by the huge inflation, as we know, which resulted in rising cost of living, which in turn resulted in the need of combining many jobs, especially for those in more precarious jobs in care. And then workers also mentioned the consequences of climate crisis. I think in Buffalo, that's quite clear, not only in the experience of blizzards, but also the consequences of wildfires, for instance, which some of workers referred to, and which were felt in particularly strong by those who anyway experienced various forms of precariousness. So here we have the quote from Teresa, a home care worker, who basically says about this intersection of various crises in her life. So she says, I kept getting stuck. I had the reliefs wouldn't show up. The babysitters went. Gas was cut off. Life was just lifing, yes. And you have to survive this. And then I already mentioned that on one hand, in the interviews we collected, was the feeling that state and federal support was not sufficient. And this was the feeling of workers, which was also visible in the Polish interviews. This was quite common, this feeling that institutions didn't help sufficiently. But on the other hand, there was this common reference to various forms of what we call biographical resources. So skills, knowledge, networks, which people acquired throughout their lives, which help them to manage to overcome the crises, not only COVID, but also earlier crises and interlinked crises. And those resources included family and community relations. Here, also the role of churches and community associations was mentioned in the interviews. Then professional resources, which included professional and emotional skills and caring ethos, which were critical of providing essential care despite limited procedure sphere and exhaustion. And then very important, probably crucial, relational resources at work, which included social networks, facilitating mutual care and support, helping to innovate collectively in the workplace in the face of this unknown virus, but also facilitating and fostering collective solidarity. And those relational resources at work, which were crucial from our perspective, and also from workers' perspective, included also trade union biographical resources, about which Jacek will tell you more.
Okay, thank you, Adam. And I will help myself with the notes. Like Adam said, in my part, I will specifically focus on importance of human activism in workers' biographies and our informants' biographies. And I will try to be strict on time. So without further ado, I will start with following this thread of biographical resources, time, and another type of the resources, which is, in our understanding, getting involved in the union. And being in the union plays a role, a specific role, unique role of biographical resource, which combines both the impact on the workplace and, more broadly, it can be understood as an essential element of workers' understanding of their life, the sense of their life, which we as a biographical sociologist, we call it a biographical identity. Of course, simplifying scientific jargon here. In other words, through union involvement, workers not only fight for better working conditions, for example, higher wages, safer workplaces, higher level of social security, but also, especially in the long-term perspective, they develop an important foundation for understanding of themselves and the world they live in. In analyzing the impact of union involvement in the interviews, we pointed to possible types of this impact, two dimensions. The first one is instrumental dimension of union engagement. And this is a situation in which the individual, as a union member, focuses primarily on the instrumental aspects of entering a union organization. Basically speaking, it is the story of union engagement is mostly on improving his or her professional situation in the workplace, bettering the working conditions. The second dimension is called the normative dimension of union engagement, and it is a situation in which we observe a link between union activity and biographical identity, and development of a sense of belonging to a broader community of professional group, being, for example, an essential worker, or being a member of union organization. Moreover, in our understanding, union engagement, and to some extent alongside this question of the nature or depth of this union involvement, stabilizes workers' biographies and reduces the effects of precarity at work and precariousness in life, which I think was mentioned by Michelle and Ian in their presentation. And it reduces these effects by giving the workers the tools to survive periods of crisis, such as pandemic, and this more chronic crisis, which Adam mentioned as well. And to demonstrate more empirically both dimensions, we have chosen two cases of care workers, two life stories. Of course, I will shortly describe them without going into too much detail. And as a first example of the instrumental type, we choose to discuss interview with Laura. She's a 60-year-old Black personal care assistant, PCA, and a grassroots organizer. Through her professional and non-professional life, she was involved in different types of care work, including working in nursing homes, hotels, and hospitals. And of course, maybe not of course, but rather not surprisingly, these jobs were mostly low-paying and generally precarious ones. In broader perspective, her life story can be mostly connected with traditional gender roles. So Laura is during her life story, during her biography, she's a wife, she's a mother, she's a niece, which is kind of important because at some point in her life, she took care of her older aunt, which plays important role in developing this being a care person to somebody, and eventually she's a grandmother. However, in her current workplace, she became involved in union organizing, which on the one hand it became kind of an attractive new activity for her. And it is a hope for improving her working conditions. So she speaks about, for example, increasing wages, making PTO rules more transparent, getting better health insurance through organizing, through fighting for her right as a member of the union. And however, we have classified this interview as a case of instrumental type. We think it is worth to mention that Laura connects her union activity with being an essential worker. And she points the role of community and solidarity between people who are in similar conditions, similar jobs, which she thinks are essential. And there is this strength to fight for better workplace. And for comparison, we choose as a normative type case case of Mandy. She's a 40-year-old mother of one. She's a Black woman working in 2 positions in Buffalo healthcare company. She's a hospital technician and nursing home certified assistant. And in her case, we see a story of actually a career within the union structure. So by her union engagement, she not only reduces her potential precarious situation at work by fighting for her and other rights, but she engages in bargaining contracts. She's an organizer of a strike during the pandemic. And in general, she developed professional ethos of care, which origins we can trace in her childhood history and her experience of caring for her siblings. And in her interview, union becomes a key element of her self-reflection, so to speak. In other words, Mandy sees herself as a trade unionist, after all, and sees her role and the mission, actually, of being a union member and working or fighting for a better cause through this union engagement. And Adam, I think I will get the conclusions. So, in conclusions, we would like to emphasize that care sector, despite these chronic problems, these exogenous shocks like pandemic, still remains. And of course, for sure, it is limited, but it still remains as a source of work and life stabilization. So working as a nurse, working in hospital or nursing homes, or the doctor, for sure, but not only, and developing a career in this industry, especially today, open opportunity to make the life a bit safer and a bit more economically stable. Important role of strengthening this effect can be played by union engagement, especially, which I think it is worth to mention, in active and inclusive unions, such the organization we found and cooperate with in our Buffalo's visit. And regarding the union activism, we see that it can have a bettering impact, and maybe it's not surprising that it can have impact, can affect the work-related problems and challenges, but which is, I hope, a kind of a message here, that it can better overall biography, and it can have an impact on biographical identity by developing this broader sense of belonging and social identity when people are engaged in the unions. Yes, so thank you.
Thank you, Jacek and Adam. I'm going to open it up for some questions. And while you're thinking of a question, I just want to say, since my life's work has been in the labor movement, that is so reassuring. Thank you. Those last words. We did similar research. Rusty Weaver did similar research in Western New York, which showed that in a survey questions that people who were involved in the labor movement feel like they have more ownership of their life and they have more satisfaction in their life overall, as having nothing whatsoever to do with the union, except that they're a member of the union, and which is exactly consistent with what you found in biographical. Yeah. Any questions? Yes, JD.
Hi, thanks to everyone for all your work today. It's really important and fascinating. You know, a lot of healthcare workers in the pandemic, which is still ongoing, and there may be other conditions joining it soon in terms of pandemic spread. A lot of healthcare workers also sort of change sides in terms of they are also now chronically ill because of long COVID. And so I've heard many healthcare workers, some talk about, you know, really their eyes being open to sort of gaslighting they had done to other patients, or what it's been like to sort of, you know, experience the healthcare system that's not set up to deal with them. Of course, I know, especially amongst low-wage healthcare workers, there's already a lot of illness and disability. But I'm wondering if these issues came up in your work, or how they came up as far as, you know, sickness amongst healthcare workers, and now the attempts to get rid of healthcare protections that OSHA is doing.
Yeah, so I think we as we did it almost 1 year ago, the situation perhaps has not yet unfolded as far as you just described, with the legal changes, yes, and illegal changes going on. But of course, the experience of illness and sickness of healthcare workers themselves and of the members of their family is quite common in the biographies which we collected. Yes, so that's also a way of learning to care, so to say, and using the care skills and getting those care skills, sorry, as well, because many workers start describing their own experience of getting into profession by presenting how did they care of their family members, parents, aunts, and other people. And then on the other hand, there is also a common, not common, but various experience, which some of them shared, of having some of their health problems either intensified or made worse as a result of the pandemic. So one of course, it includes various kinds of occupational injuries related to bodily work people had to do as a care workers. Like lifting heavy patients, turning them during the pandemic, and so on. But on the other hand, which is quite interesting, because we didn't have so many of those stories in our Polish interviews. Quite a lot of workers mentioned also side effects of vaccination. That was kind of strange to hear, and not so often in our earlier interviews in Poland, but there were the cases, and even more interesting, this side effects of vaccination has not changed generally positive and supportive approach towards vaccination as such. Yes, so people were telling that they were suffering, but they were still, especially as union activists, as union leaders in their workplaces, they had to convince other people to get vaccine, because they thought it's something which is important. Yeah, so yeah.
Thanks, JD, for that question. Important. Zoe, go ahead.
Thanks so much. This is all super interesting, and I just had a quick comment connected to what you were saying, Cathy. I think it's actually really helpful and interesting to hear about that side of the benefits of unionization, because I think very often research focuses on the sort of material effects of like wages and certain working conditions, but that actually like what is a really important part of it for many people who are actually participating in unions is that sense of agency in a context when just like agency is kind of the last thing that many people feel in the workplace. And it feels to me just like that's actually such an important thing, even more so in the current political moment, to emphasize that unions aren't just about getting better wages, but it's also about like bringing more of a sense of democracy and a sense of agency into the workplace. And so I think it's really helpful to have research and narratives that helps to kind of draw out that aspect of it.
The Biden administration had on its website something called the Union Advantage. It's probably been removed. And it talked extensively about this issue, the agency and other non-tangible, like economic reasons to be members of the union. Yeah, so thanks, Zoe. Carol?
Yeah, thanks a lot. That was super interesting. If I may exaggerate your argument a little bit, I would say that you claim that unions stabilize people's lives, and to some extent they synergize with the care sector profession, right? By providing this kind of stability, allowing workers to focus also on their care job. But I wonder whether there's kind of like an element of the conflict that unions introduce, particularly given that, if I understand it correctly, the sector is basically private, right? So you have this kind of like conflict with the private employer, kind of workers being having, okay, I'm taking care of people's lives, but on the other hand, there's like a large employer profiting off my job, and maybe unions are also introducing a component of conflict, right? So I wonder whether you have any comments on that. Thanks.
Yes, absolutely. Yes, there is stabilization at the level of biographical experiences, in the sense that unions help to have better work simply environment. Yes, in many ways. But on the other hand, the same unions, and we have narratives about that, are entering into the conflictual relations with employers. But what is interesting is that this conflict, it's interesting from the European perspective, but this conflict in Buffalo, at least in hospitals and in some nursing homes, is much more institutionalized. It's much more followed. Yeah. It's a conflict which resembles more, kind of German model of co-determination. Yes, in terms of the regulation at the workplace level, than the conflicts which we observe in other places. So because of this routine of collective bargaining runs, collective agreements, and so on and so on, that's an interesting, indeed interesting tension, because it's on the one hand there is of course conflictual relation with employer, but on the other hand is regulated because of the rules which were followed. On the other hand, I will pass it to Jacek. On the other hand, when you look at the home care workers situation, when this organizing is still going on, but it's much more conflictual dynamic. Yes, there from the perspective of interviews which we collected, and Laura, who Jacek quoted, was organized and joined the unions in this home care sector.
Yeah. We have stories of the strike during the pandemic, which was very interesting as well. And but I think that I'm like Carol, I'm still fresh sociologist of work, so for me a lot of information that I got in the US was totally new. So this idea of closed shop and this union engagement in contract bargaining, that's something which actually gives the unions a kind of agency, and possibility to impact the way of manage of the management, the hospital or the nursing home, whatever it is. I mean, it is real. You can through the union engagement, through the union negotiations, you can actually affect the way that your workplace is run, and this is very interesting, especially in comparison to Polish case, where it's very hard to manage, because you have always another level, another step of the management. There is a kind of local governments, local authorities, central authorities, ministry, and so on, so on, so on. And here, if you are able to organize yourself, you can have real impact on your workplace, actually, and very, very visible, so to speak, impact. So yeah, again, kind of a positive message, but hopefully.
Yeah, some employers may say the union runs the joint, but not really. Thank you, Carol. Marquetta. Am I saying that right?
Yes.
Okay.
Yes, perfect. Thank you.
All right.
Thank you very much. Thank you, Adam and Jacek. Listen, I have a question about your analysis and about your analytical dimensions, because, well, if I wanted to be a little bit provocative, I could say, well, those instrumental and normative dimensions, they are just your construct. Maybe in the biographies of people, they can coexist. They don't necessarily are distinguished. They are not separate, because I can imagine a person joins the unions and at the beginning is very much interested in what can be gained here, how can we improve our working conditions, and then in the course of time, there's some identity work involved. A person feels more empowered, and this activism, trade union activism, becomes really biographically meaningful. So maybe those two dimensions can coexist, but you probably had some reasons to distinguish them. So my question is, what did you want to achieve by talking separately about the instrumental and normative dimensions?
Yeah, they always coexist in different not proportions, because it's not something to be quantified, but they coexist in individual lives and motives of joining unions. What we wanted to achieve is to show that union is something more than business union, and but for those people also union is more than just this kind of business union, and that quite often the first step is to achieve very concrete, tangible goals, and then for many people, being a part of the union becomes something more, which helps them to cope with various biographical problems they had throughout their lives, which helps them to overcome, for instance, the situation in which you never had a place and space to say something in public because your husband was basically trying to keep you off the job of this public space, or the union becomes a way of dealing with various dimensions of your gender identity, or the union is something which helps you to deal with various aspects of your racialized identities, and in fact, seen from this perspective, this distinction makes sense because it speaks to what we saw in the data. So you have the cases in which there is much more emphasis, especially among those who are newcomers to the union, on those more instrumental benefits at the very beginning, and then there is a moment when something which in biographical research we sometimes call biographical metamorphosis takes place. And this biographical metamorphosis is the moment when people look back at their experiences and say, well, in fact, the union was an important mechanism of making my life richer or achieving many more things in my life. Yes, and we are not defending, you know, this distinction as something which is distinction
for sure.
between two types of people. These are two patterns which basically intersect with those biographies at various stages of human involvement. But what we try to defend here is simply the statement that trade union is a resource people can use to cope with a lot of problems which are not necessarily workplace related problems, which are the problems of various intersecting crises they have to cope with in the society they live in. Thanks. Jacek?
Even in these cases, in these both cases, which are, you know, which were chosen to you know, to show you kind of a differences between both types or both dimensions. It's you know, if you read the interviews, you would find traces of both
patterns.
I don't want the patterns, so to speak. Yeah, thank you. And this is kind of, and of course, but again, it's, for example, a thing of being longer or in the union, or being you know, kind of socialized in the union, the way that the union actually socialize their members. So you know, that the one of our unions actually do a lot of educational work, you know, workshops, seminars, and then you have, of course, we didn't have time, and this seminar, this webinar is not about, you know, showing you deep analysis of each case, but yeah, there is a lot more for sure in the whole collection.
And sorry, I just want to add one thing which is important from this comparative perspective. I think what is amazing in the case of unions we had the pleasure to work with in Buffalo is that those unions, despite this high level of institutionalization, being a part of collective bargaining, this co-management kind of pattern, they are still quite close to the idea of unions as social movements. And I think that so we observed similar patterns in our Polish collection in the case of unions which were usually smaller radical unions doing trade union organizing, for instance, in nursing homes, and there indeed a lot of people had this feeling of empowerment through unions. But then in Buffalo we had the unions which are quite established, which are, you know, a part of the institutionalized industrial relations, and still they function as social movements. And I think that there is something which I personally see as a hope for revitalization of labor movements, some kind of inspirations which can be drawn. Yeah, thank you.
I had a question for Ian, for you too. What was the role in your biographical interviews? What was the role of racism and race in particular?
Well, I mean, so if you read about criminal records and employment, normally what you see is studies about racial discrimination at the hiring phase. And so you hear about kind of race and criminal records intersecting at that stage. But of course, if you do a biographical interview, what you hear about is a lot more than that. So, for example, you hear about people healthcare workers getting bullied by their black healthcare workers getting bullied by their white patients, and feeling bad and sometimes even quitting their jobs because they can't take it. Or you hear people talking about their parents and their grandparents and how they inherited, like what Adam and Jacek heard, the generations of working in low-wage care jobs, but also people talking about the legacy of, well, they're moving up from the South, Great Migration, or their parents moving up from the South, or their grandparents, or their ancestors who were enslaved. And some of them talk about how this legacy affects them. And that's something that so I do a lot of work in Europe. You don't hear that in Europe, and that makes this group really different. And so yeah, it comes up all the time in a lot of different ways, not just employers not hiring people, but just, yeah, everyday life.
Adam and Jacek, do you have anything to add to that? Like something that maybe, because you come from Europe, it's different, something you didn't expect?
Yeah.
In terms of
You
the
want to start?
experience of, yeah, well, you can, Jacek, go ahead.
I'm not sure I can add something. I don't know, something. I don't want to say new because this is obvious. It was obvious for us that we are strangers, so to speak, during this research, and we even had a problem to talk. I mean, to ask directly at some point because we weren't sure about even our language. I suppose is it like asking about experiencing racism? Is it like okay question during the from methodological point of view? However, it can be like I don't know, kind of an absurd because this is nothing to be ashamed of. You should ask about these things, but we had kind of a problems. But what I wanted to say is that for me personally, it was striking how deep racism is I don't know, institutionalized in American society. How when general people of color started to talk about it during the interviews, it was striking how many stories connect to experiencing racism in different dimensions, not only workplace but in personal lives. So yeah, so that's kind of a maybe not so to speak scientific observation, but it was striking, and basically speaking, I thought it's like better, but it didn't. It's not. I don't know, Adam. If you
No, well, I think it's also the matter of two white guys speaking to people who are not only in different country but they're also in different parts of the society, and I think the fact that we were strangers somehow helped us to get those
to some
stories of
extent, for sure.
racism in some cases, because I think in the second round of interviews which I did in May, which were facilitated by SEIU, so with workers in generally lower wage part of the care sector, who were predominantly black. The stories of everyday racism came spontaneously out of the interviews. So this was not something which needed additional questions, but a lot of people just mentioned it spontaneously, and then this was also one of the reasons of seeing union as a part of the solution to the problems which they faced. On the other hand, we also heard some stories of tensions around racial discrimination within the unions, which was also quite interesting. And then finally, for me, it was very interesting to hear how this the issue of racism is talked about by precarious, poorer white workers who were not you know, in the higher positions, who did some kind of maintenance jobs or support jobs in nursing homes, for instance. That was also a different way of talking about their experience of racial divides and inequalities. Yes.
Can I just add something real quick? So I was a stranger too, as a white guy, who's a university professor, talking to mostly Black women who have kind of been living, well, they've been living in this city that I very rarely even visited, much less have a deep understanding of their lives. And it was my job to sit there and get them to tell their stories. And I think that for many people I spoke to, it was like they really appreciated someone who cared about them, what they had to say, because they live in a society where their voices are not valued. So this is one of the things that I think we're trying to work out in presenting this research, is how to lift up the voices and not just do what we academics normally do, which is tell everything in our voice.
Jason?
Yeah, I just want to commend, I haven't been talking about what Ian just talked about, which was, I know from working with the clients and also, you know, in terms of understanding my place in the world and the folks who I'm communicating, and sometimes in terms of that, you know, it's very important for me to understand that I have very little understanding of where they're coming from, because my background is so different, even though I grew up, you know, not far from the city or had, you know, lived in that city, that our lives are separated differently. But I really love hearing about, you know, the biographical approach. And I've often found when we talk with people, we talk to them about criminal records. We don't ask them about like the criminal record. We're not like, oh, what happened there? We really kind of do more like, tell us about your story. And it really, I never thought about this until like listening to, you know, this has really been enlightening for me to look at a different spectrum. But I can tell how much it means to the people we work for, that we honestly are like sitting, holding space for their story, for their experience in life, for how much it means for another human being to talk to another human being who is completely, you know, in some sense could be an alien, because they've come from a completely different background, a completely, you know, they're exercising the space in the world so different because of racism, because of you know, misogyny, about all these oppression and all these forces that sometimes I know are there, but I'm not coming in contact with because of my privilege in the world. And it just means how much it means for people to be able to be asked, like, what's your story? And not like focus on these things that I'm interested in. But so it was really interesting for me to hear that approach. And I know from when we do talk to clients, because we're often trying to get a story of like, okay, this crime happened and you're trying to get this job. I know like the 2 points, but tell me about all the things in your life that have happened since that crime, and like why, you know. And that story is usually where I found is the most paid. And so to see this kind of approach, I think not only is it wonderful to see people's stories shared, but for the populations that we are trying to serve, for them to understand that there's people out there that want to hear their stories. That is so empowering, I think. But thank you. Whole thing has been just fantastic. I really do appreciate all the work that has been done by the team here.
All right, I think we're going to close if we don't have it, unless somebody has a question. Somebody else have a question? Thanks so much, Adam, Jacek, Ian, and Michelle had to leave. We recorded this and we're going to share it with we'll share it with you, Jason, in your group, and the other groups if they would like, and with the unions that help participate too. And
thank you.
All right. Goodbye,
Thank you very much.
Thank you so much.
Thanks again, Cathy.
Great to see
Thank
you.
you.
For
Thank you for
everything,
coming.
actually.
Thank you for
Especially for introduction.
Yeah, next year in Poland. Yeah.
Thanks. Bye bye.
Yes.
Bye.